Because every great research project, whether it's about treating cancer, evaluating mental health, or improving maternal outcomes, starts with a solid understanding of the problem. And yet this is where most students struggle. So in this video, we'll break it down step by step. I'll show you how to go from confusion to clarity. When crafting your own research problem, what is a research problem and why does it matter? Let's begin with a simple truth. The world is full of problems. From the increasing rate of antibiotic resistance in ICUs, to the poor uptake of vaccines in urban slums, to the rising mental health burden in post-COVID society, we are literally surrounded by issues that demand scientific inquiry. Yet many students overlook these and jump straight into choosing a topic. Big mistake. Selecting a topic is not the first step in research. Identifying a research problem is, and here's why this matters. A research problem is the gap in knowledge, the unexplained phenomenon, or the practical challenge that you're trying to understand, solve, or explore. Let me give you an example. Imagine you're a final year MBBS student working in a gynecology ward. You notice many patients with gestational diabetes are not following their dietary restrictions. It's not just a random observation. It could be the beginning of a research problem. But to make it researchable, you'll need to dig deeper. Is it due to lack of awareness? Cultural dietary practices? Poor counseling by healthcare staff? These are all variables, and now you're starting to think like a researcher. Common misunderstandings topic versus research problem versus statement. Let's clear this up once and for all. Many students confuse the terms research problem, research topic, and problem statement. But these are not interchangeable. 1. Research problem, a gap or difficulty in practice. Or theory 2. Research topic, a broad subject area. 3. Statement of problem, a concise, specific question or hypothesis. Let's understand with examples. Low adherence to insulin therapy in type 2 diabetes patients is a research problem. Insulin adherence among diabetic patients is a research topic. What are the factors associated with low adherence to insulin therapy among urban diabetic patients aged 40 to 60? Is a statement of problem? How to identify a research problem? Let's walk through this as if you're doing it yourself. Step 1. Choose your field of interest. Choose a field that truly interests you. This could be pediatrics, oncology, public health, psychiatry, obstetrics and gynecology example. Let's say you're interested in women's health. It's your broad field. Step 2. Develop mastery in that field. You need to know the subject well. If you don't, commit to learning more through clinical exposure, reading updated guidelines, attending CMEs and conferences. Example, if your field is psychiatry, you're seeing rising cases of postpartum depression, but no local data exists. That's a red flag for a potential research problem. Step 3. Review existing literature. Start reading. Research papers, dissertations, WHO and CDC reports, local health department data. Let's say you find that while postpartum depression is well studied in high-income countries, there's very little data from South Asian urban slums. Now you've found a gap, and that's gold for researchers. Step 4. Prioritize the problem. Think critically. Which problem matters the most today in your context? Use the following filters: public health relevance, disease burden, feasibility policy gaps, vulnerable populations. For example, childhood anemia may be an old problem, but if there's a sudden spike in your city due to rising junk food culture, it's relevant again. Step 5. Use insight. Experience and expert help reflect on your clinical rotations. Speak to experienced clinicians, nurses, or supervisors. They often know the ground realities that literature might not yet capture. Example, your pediatric supervisor might mention that despite iron supplementation, anemia is not declining. You dig into the records and find poor parental compliance. Now you're getting somewhere. Step 6. Narrow it down. Pinpoint your researchable problem. Now, it's time to convert your broad curiosity into a focused research question. This means identifying specific populations, specific locations, specific variables. Example, why are caregivers of children under 5 in XYZ district not complying with iron supplementation programs? Sources of a research problem. Where do great research problems come from? Clinical practice, real patients, real challenges, public health data, government records, and community surveys. Academic research read journals like The Lancet, JAMA, or BMJ Open. Policy failures, failed programs like polio refusal in certain communities. Discussions, seminars, journal clubs, and even casual chats with seniors can inspire research questions. Your own curiosity ask, why? What if? Is this the best way? Many great medical discoveries began with a curious question, not a lecture, getting a good statement of the problem according to research expert Kurlinger. A good problem statement must meet 3 criteria. 1. It should involve 2 or more variables. 2. It must be written as a question. 3. It should be empirically testable. Let's apply this to a medical research idea. Bad. I want to study hypertension. Better. How does salt intake relate to hypertension among adults in coastal communities of Pakistan? Now that is researchable. Delimiting the research problem to keep your project focused and manageable, you need to draw boundaries. We call this delimitation. Here's what you should define. 1. Variables. Focus on 1 or 2 key variables too. Population: define your age group. Gender. Religion. 3. Sample size. Keep it realistic for your time and budget. 4. Methodology. Choose one best method. 5. Tools. Use validated questionnaires or digital tools. Example. You want to assess awareness about HPV vaccination. You delimit it to female college students aged 18 to 25, using a self-structured validated questionnaire. From 3 private universities in Lahore, now your research has focus and feasibility. Evaluating your research problem. A self-check. Ask yourself, 1. Is it researchable? Can I collect data and analyze it? 2. Is it new? Or has it already been done hundreds of times? 3. Is it significant? Will it help patients, clinicians, or policies? 4. Is it feasible for me, given my time, skills, and resources? Use this checklist to make sure you're not setting yourself up for frustration. Remember, no matter how fancy your methodology or analysis is, if your problem is weak or unclear, your whole research will crumble. But with this step-by-step guide, you're ready to tackle it head-on. If you found this video helpful, give it a thumbs up, share it with your classmates, and don't forget to subscribe for more medical research tutorials. Drop your questions in the comments below. Till next time, stay curious, stay evidence-based, stay impactful.